For patients diagnosed with mesothelioma, maintaining physical strength and functioning is extremely important for overall health, quality of life, and ability to undergo various treatment options. While aggressive cancers like mesothelioma can often cause fatigue and weakness, engaging in regular strength training exercises can help combat these symptoms and keep the body as strong and able as possible. Including strength training into a mesothelioma patient's overall exercise routine requires careful planning and precautions, but done correctly it provides great benefits. It's always essential for mesothelioma patients to consult their oncologist or physical therapist before beginning any new exercise regimen. Physicians can assess each individual's current fitness level and limitations, as well as any contraindications to certain exercises posed by their specific cancer stage or medical treatments. For example, exercises that dramatically increase heart rate or breathing may not be appropriate during chemotherapy cycles. Additionally, exercises that put strain on the abdominal area may need modification for patients whose cancer has spread to involve the lining of the abdomen or diaphragm. When given medical approval to begin strengthening activities, mesothelioma patients should start very gently with low-resistance exercises that target the major muscle groups. Good options to try initially include exercises that can be done sitting or lying down, such as arm/wrist/hand exercises using therapy bands or small weights, bicep curls, shoulder presses, wrist curls, extensions. Start with very light resistance and slowly increase as tolerated. Leg, ankle exercises, straight leg raises, leg curls, extensions, ankle pumps, circles. These can be done seated or in bed. Back, core exercises, seated back extensions against the wall with support, sitting pelvic tilts, abdominal isometric holds. Breathing exercises, deep breathing using pursed lip breathing technique to strengthen respiratory muscles. For the first few weeks, focus on higher rep ranges, 15 to 20 reps, with very short rest periods of 30 to 60 seconds. This helps build endurance and muscle tone safely without straining. As strength improves, the rep range can gradually decrease to 8 to 12 reps with slightly longer rest between sets of 1 to 2 minutes. Always listen to the body and don't push through any chest pain, dizziness or extreme fatigue. In terms of frequency, 2 to 3 non-consecutive days per week of strength training is usually sufficient when first starting out, allowing for adequate recovery. Over time and with medical guidance, frequency can potentially increase up to 3 to 4 times weekly, such as strength training on Mondays, Wednesdays and Fridays for example, doing 30 to 45 minutes each session. It's critical not to strength train on consecutive days while undergoing cancer treatment. As strength and endurance increases over weeks, months, mesothelioma patients can gradually incorporate more challenging and varied exercises. Some good options to add are lower body strength using leg lifts, mini squats, leg presses or wall sits, progressing to bodyweight or lightweight squats. Upper body using bicep curls or tricep dips with weights or resistance bands for added challenge. Core work like planks, side planks or abdominal crunches in various positions. Full body exercises like push-ups against the wall or using an inclined surface. Combination exercises pairing upper and lower body movements. While lifting heavier weights is generally not advised for cancer patients, the occasional use of very light dumbbells, resistance bands or plastic exercise tubes can help further stress the muscles over time if cleared by a medical provider. Machine-based strength training could also eventually be incorporated at a physical therapist's discretion depending on how treatment is progressing. Constant re-evaluation with one's medical team is of utmost importance. Along with proper technique, good form and control of movements are especially vital when exercising with mesothelioma or during cancer treatment due to potential frailty and fatigue. Always use a comfortable pace without straining or pushing through pain. Flexibility exercises should also be incorporated to counteract any shoulder or back tightness from strength training. Gentle yoga poses, stretches or range of motion movements 1 to 2 times per week can aid flexibility. making strength training enjoyable with variety. Music and even exercising alongside supportive family or friends is another important factor that helps mesothelioma patients adhere to a long-term strengthening routine. Proper hydration before, during and after is also necessary, along with balanced nutrition from protein-rich whole foods to support muscle recovery and growth. Strength training, performed carefully and gradually under medical guidance, has considerable potential to empower those living with mesothelioma while enhancing well-being, daily functioning and possibly even treatment tolerance and outcomes. Regular reevaluation with an exercise specialist or physical therapist ensures the safest progression, as this important workout regimen provides more and more enduring benefits. Mesothelioma patients can safely incorporate strength training into their exercise routine by starting gently at a level appropriate to their fitness, gaining medical clearance, focusing on form and control over weight amounts, reps, limiting frequency while on cancer treatment, emphasizing flexibility, mobility, work 2, prioritizing enjoyment, hydration and nutrition to support muscle recovery, and collaborating closely with the medical team for program individualization and progression over time. Done correctly with all necessary precautions, regular strength training can help mesothelioma patients maintain physical functioning while also experiencing quality of life improvements from reduced fatigue and increased strength.